Female pelvic health is basically the optimal functioning of the female pelvic organs, meaning bladder, bowel, and the pelvic floor. Pelvic health disorders are actually prevalent in 1 in 4 women. Incontinence is the most prevalent, followed by pelvic pain, and then followed by pelvic organ prolapse.
Pelvic health disorders and diagnoses are not a one-size-fits-all. Our goal is to create a center for women where we use an interdisciplinary approach with several subspecialties, working in a team.
Pelvic floor disorders affect women across all stages of life. There are a lot of risk factors for pelvic floor disorders. Aging is definitely one, menopause. There are behavioral risk factors as well. So nutrition, obesity, smoking, genetics also plays a role as well. There are a variety of symptoms that are associated with pelvic floor disorders. It could start with menstrual disorders, heavy painful periods, pelvic pain in general, urinary incontinence, fecal incontinence, difficulty controlling their bladder.
Unfortunately, as women, sometimes we don't always talk about what we're going through, either because we think it's normal or we're embarrassed.
If a woman has these symptoms, the first thing to do is talk to their provider. Understand that it's normal and it's treatable. Understand that other women have the same issue, so they shouldn't be embarrassed and they shouldn't feel shameful about it. We treat each patient as a person, as a human being. You know, a patient is not a number. We really care. We really want to help.
We have created a center so that we can personalize treatment. In order to get started with the Pelvic Health Center, it's important that you talk to your primary care providers, your GYN providers. There is a link on the Rochester Regional website. The Pelvic Health Center does have their own page. You can just click on the link, submit your information. That'll go to some of our team members who will then contact you to help you make an appointment. The initial consult will be with myself, and the intent of this visit is to understand your needs and your complaints. That will allow me to work with my team of providers. Our goal is to work as a team, interdisciplinary, so that we can ensure that we are addressing any complaints, any issues you may have, and anything that's going to help improve your quality of life.
Really, the first thing is just to talk about it, to have a good discussion about it, and then we can start, putting the pieces of the puzzle together and formulating a treatment plan to help them.